This is an educational video regarding medical marijuana for chronic pain, education for nurse practitioner students. You may be asking yourself, what is medical marijuana? Medical marijuana is a plant that has been used for medicinal purposes for thousands of years. The marijuana plant makes a thick resin which contains compounds known as cannabinoids, which are chemical compounds that act on cannabinoid receptors. And although there are over 100 cannabinoids found in cannabis, the two most commonly studied are the delta-9 tetrahydrocannabinol and cannabinol, also known as THC and CBD. So what is chronic pain? Chronic pain is persistent, debilitating pain that lasts greater than 3 months. It can occur due to underlying causes, affects roughly 100 million U.S. adults, and costs the nation approximately $560 to $635 billion in direct medical costs annually. To address pain, over the past decades, opioid analgesic use has dramatically increased. Substances used for chronic pain include NSAIDs, alcohol, nicotine, and opioids. Chronic pain patients are up to 60% more likely to endorse heavy drinking, and nicotine, like alcohol, people with chronic pain are about twice as likely to be current smokers, with the rates of smoking among treatment-seeking pain patients ranging from 49% to 68%. And the aberrant use of opioid medications is a growing public health crisis. The prescription of opioid medications are the most prescribed treatment for chronic pain relief. So the opioid epidemic. Like I said, the most common treatment for chronic pain is the pharmacologic use of opioid medications. Chronic opioid leads to tolerance, which predisposes patients to opioid dependence, abuse, and addiction. Opioid prescriptions for chronic pain are currently 3 times higher than ever before. This spike in prescription opioids has contributed to over 400,000 overdose deaths. The opioid epidemic has become an increasingly pressing problem, with nearly 36 million people abusing opioids around the world. The Centers for Disease Control reports that 115 people die every day of an opioid-related cause in the United States. And lastly, the United States consumes 80% of the world's supply of prescription opioid analgesics, and opioid drug overdoses now outnumber automobile and handgun deaths in the U.S. What effect does medical marijuana have on chronic pain? Well, the endocannabinoids impact physiological processes such as pain, mood, memory, appetite, anti-inflammatory responses, reproduction, and immune system regulation. Cannabinoid receptors such as CB1 and CB2 are present naturally in the pain pathways located at both the peripheral and central levels. They modulate neural conduction of pain signals by mitigating sensitization and inflammation. Cannabinoids affect pain through the endocannabinoid system, which has receptors in the central nervous system, periphery, immune, and hematologic systems. The two most suddenly cannabinoids, as previously mentioned, are THC and cannabinol. THC functions by inhibiting glutamine and 5-hydroxyprotamine release and increases dopamine secretion. CBD enhances adenosine receptor signaling and decreases reactive oxygen species, tumor necrosis factor, and T-cell proliferation without the psychoactive effects of THC. The multifaceted analgesic and anti-inflammatory properties of cannabinoids and positively influence the perception of pain across numerous conditions. So by understanding the function of endogenous cannabinoids and helping explain the efficacy of exogenous cannabinoids, you can understand what effect medical marijuana has on chronic pain, as seen in these 2 slides here on the left. You may be asking yourself, what kind of evidence supports the use of medical marijuana for chronic pain? Well, there's actually quite a bit. The National Academy of Science, Engineering, and Medicine concluded there's substantial evidence that cannabis is an effective treatment for chronic pain in adults. The Journal of American Medical Association published a meta-analysis concluding that there's evidence to support the use of cannabinoids for the treatment of chronic pain. Furthermore, in 2015, the American Pain Society distributed a meta-analysis which showed that medical marijuana provided relief of chronic neuropathic pain for 1 in 5 patients. And a systematic review done by Aviram and Samuel Lightock in 2017 indicated that medical marijuana reduced pain by 30 to 50% in a substantial number of patients. Utilization of medical marijuana for chronic pain has shown an increase in physical functioning, energy level, mood, enjoyment of life, social engagement, ability to work, and sense of hope, as well as a reduction in seizures, nausea, vomiting, loss of appetite, muscle spasms, anxiety, depression, insomnia, and weight loss. Any other medication, there are several adverse effects associated with medical marijuana. However, they are relatively few. Common side effects include diarrhea, dry mouth, anxiety, dizziness, impaired attention, disorientation, panic reactions, and impaired drive-in performance. Some leading contraindications are current, past, or strong family history of psychosis, pregnancy or planning to become pregnant, younger than 25 years of age, current or past cannabis use disorder, current substance use disorder, tobacco smoking, respiratory disease, and cardiovascular disease. And some general precautions for patients are with current mood or anxiety disorder, high risk of cardiovascular disease, and/or use of alcohol, opioids, and benzodiazepines in high doses. Here are the recommendations for clinical practice from the Biomedical Journal. This was published just last year in 2021. As you can see here, that the potential benefits of medical marijuana greatly outweigh the potential short-term harms. You can see that more than 100 people had a reduction in pain, improved physical function, and improved emotional function here on the right-hand side over 1 to 4 months, as well as an improvement in their sleep. And the only short-term harms that were experienced, which were relatively few, was cognitive impairment and drowsiness. So when it comes to referring patients for treatment, as of 2021, a total of 36 states have legalized medical marijuana for medical purposes. And although medical marijuana is legal in more than half of the U.S., it is still classified as a Schedule I drug. Nurse practitioners are likely to be involved in policy developments and consulted on legal matters for the utilization of medical marijuana in healthcare settings upon graduation. While there are 18 states that authorize nurse practitioners to certify medical eligibility for medical marijuana, nurse practitioners in Florida cannot prescribe it. However, they can recommend it to their patients with chronic pain, which is very important here. After recommendation, patients would be referred to a physician who is licensed in the Medical Marijuana Use Registry to obtain a medical marijuana card. Patients can then purchase cannabis products from a licensed medical marijuana treatment center in the state of Florida, and currently there are over 140 operating locations in the state. So, you might be asking yourself, now that you have all this information, how does this impact the opioid epidemic? Well, it's impacted it in a few ways. As you can see, the legalization of medical marijuana into clinical practice has been associated with a decreased opioid use disorder, decreased opioid overdose mortality rates, a reduction in hospitalizations related to opioid complications, and a reduction in the prescription of opioid analgesics. Furthermore, when patients have access to medical marijuana, individuals currently using opioids decrease their usage by 40 to 60%. Wow. And a recent examination of Medicare claims data showed that the use of prescription opioid medications was significantly reduced in states following the implementation of medical marijuana laws. And that's all I have for you guys. Thank you so much for participating in this project. To complete the post survey, please use the link that is in this slide in red, or you can click on the link which is posted in the description box of this video, or scan the QR code here on the right. Thank you.